Hello, hello, hello. Welcome back. This is the second series of our masterclass, and today we'll be talking about paper two. So, the person that will be talking about this paper two is, drum roll please, the overall best graduating student of our set. Yeah, and he finished with, should I say, his CGPA? It's above 4.8, yeah. So, of course, you will know that he has values to put out. So I would love for you to pay attention, get your book, get your paper, and jot and get enough from him. All right. So now I'm putting him on stage for you to for him to continue. Thank you.
Okay, so good evening to you all. Akelaido Victor. So I'll be the one that will be handling paper two. So as Felicia has earlier said, she lectured you guys this afternoon on paper one, which entails anatomy, physiology, um, public health, pharmacology, and the rest of it. So I'll continue from where she stopped. So on anatomy and physiology for paper two, I'll be teaching you guys on neuroanatomy. So when you hear the word neuro, what does neuro means? Neuro is a term that is gotten from nervous system. So and anatomy, what is anatomy? Anatomy is the study of structures and organization of living organisms. So putting those words together, neuroanatomy simply means the study of structure and organization of the nervous system. And we all know that the nervous system has to do with the brain, the spinal cord, and the nerves. These are the three major components of the nervous system. Now, when we talk about the brain is complex in nature, though when explained, it is easy. So, the brain has four major lobes, and the lobes are the frontal lobe, the two parietal lobes, and we have the occipital lobe, then the temporal lobe, which is closer to the ear. Each lobe has its own distinct function. For example, the parietal lobe is responsible for sensation. That means it sends sensory information. When you feel pain, it is the work of the parietal lobe. Knowing the temperature of your body, either cold or warm, is also the function of the parietal lobe. And also, it allows you to also feel stimuli such as touch. When someone touches you, how you are able to feel that someone touched you is the function of the parietal lobe. While for the occipital lobe is responsible for visual interpretation, how you see colors. This is a red color, this is a blue color, this is orange color. Those are the functions of the occipital lobe. While for the frontal lobe is majorly composed of the cerebrum, which is responsible for cognitive functions and mental thinking. When you want to crack your brain, when you want to do anything that requires you doing calculation, require you thinking, problem solving, decision making, those are the functions of the parietal lobe, the frontal lobe, sorry, which contains the cerebrum. Then the temporal lobe, this is your temporal lobe here. You can see that it is closer to the ear. So the function of the temporal lobe is for visual and auditory information processing. So that is the function of the temporal lobe. It tells you to interpret sounds, whatever you've heard. It is the function of the temporal lobe to interpret it into meaning for you. Whatever you have seen, the temporal lobe would interpret it into meaning. So that is it. Then, apart from the lobes which are present in the brain also has um, divisions. It has divisions. So I can call the divisions the um the prosencephalon, which is the forebrain, we have the mesencephalon, which is the midbrain, and we have the wombencephalon, which is the hindbrain. So for the prosencephalon, it is majorly composed of the cerebrum, and I've said earlier the functions of the cerebrum for mental thinking, problem solving, and decision making, judgment, the rest of it. Then the midbrain, the midbrain is the mesencephalon. The function of the midbrain is it helps to interpret visual and audio information. Whatever you have seen, whatever you have heard, that is the function of the midbrain. It interprets it. While the hindbrain, which is composed of the cerebellum and the rest of it, the cerebellum, the brain stem, you have the brain stem. The brain stem is composed of the pons, the medulla oblongata, and also the midbrain. So that is the divisions of the brain. Then on our slide here, the next thing I'll be talking about is fluid and electrolyte and acid base balance. In the body, everything has to be balanced, and that is why we have what we call homeostasis. Homeostasis, the function of homeostasis is that it helps to maintain a constant and a fairly constant internal environment despite changes in the external environment. So that is the work of homeostasis, and it does not just come into play without some systems being responsible for it. There are many systems that are responsible for this homeostasis, that is maintaining balance in the body. So the first one I'll be talking about is the respiratory system. The function of the respiratory system, other than breathing, it also has um it also plays a crucial part in maintaining of the acid base balance in the body. For example, we all know that CO2 is slightly acidic while oxygen is a basic component. So when there is excess of CO2 in the body, we have what we call, it will lead to what we call respiratory acidosis. And once this occur, the only thing the body will do is it responds to it by causing hyperventilation. What I mean by hyperventilation is you start breathing fast, like just as if you are panting. So as you are panting, you are trying to expel the excess CO2 in the body, thereby bringing the body to a balance. We all know that um the pH of blood is 7.35 to 7.45. So it must not exceed that level, and it must not go lesser than that. Otherwise, there will be a lot of dysfunctionality in the body system. So that is all about the respiratory system in regulating the acid base balance in the body. Then we also have the kidney. Let me recall your mind back to your production of urine. In production of urine, we have what we call tubular secretion. That's the function of the kidney. In production of urine, we have what we call tubular secretion. In tubular secretion, hydrogen ion is being secreted into the what? Into the waste that would be expelled out of the body through the urinary system. Hydrogen ion is usually expelled out in order to control and to maintain the acid base balance in the body. Then also in your tubular reabsorption, CO3 2 minus, that is bicarbonate, is usually reabsorbed back. Excess of CO3, CO2, CO3 2 minus, which has been secreted earlier, would be reabsorbed back into the body system in order to bring about a balance, because disruption in this balance is very dangerous to the body. So that is the function of the renal system, which is the kidney, in maintaining this acid base balance. Then um the next one I'll be talking about is the electrolyte. We have many electrolytes in the body which they are very essential, and I'll be talking about the major ones that we know, which is sodium, potassium, calcium, and also magnesium. Both sodium and potassium is very essential in the body, as this help in various physiological functions. For example, your heart cannot work without this sodium and potassium in the body. Also, our musculoskeletal system, dey can't function without sodium and potassium pump, which is responsible for contraction and coordination of the muscles in bringing about movement. So dis electrolyte dey must be in adequate amount in the body. It must not be high and it must not be low. It must be in an adequate amount to maintain the balance. Otherwise, if there is, for example, if there is hypocalcemia, that is a low level of calcium in the body, the person would have tremor, the person won't be able to move because calcium is responsible for contraction, and once there is contraction, the person is able to what? To move. So once there is a lower level of calcium in the body, definitely the person movement will be affected. So that is one of the major reasons why this electrolyte must be maintained in our body system. If someone is having dehydration now, your body system, which is your hypothalamus, it would send an information to your brain, and your brain would initiate the test mechanism, and once it is initiated, then you will feel tasty and you drink water. All of these are just to maintain homeostasis in the body system. So the next one I'll be talking about is our mental health nursing. Mental health. We as student nurses, I am no longer a student nurse, but to my colleagues who are still student nurses, so you have to pay attention to your mental health. The reason is that as you are being stressed in school due to a lot of activities, your mental health might be affected, and once your mental health is affected, the whole of your body is affected, because your mental capacity is in your brain, and once the brain is affected, you should definitely know that everything about your body system is also what? Affected. So your mental health is very crucial. You should pay attention to it. So what is mental health? Mental health is the ability, or is the way an individual adapt to stress and situations surrounding him or her, and how that person is able to make contribution to his immediate society. So that is mental health. How you are able to adapt to stress, to challenges. That is mental health definition. The opposite of mental health is mental illness or mental disorder, and that is a dysfunction in the normal psychological processes of the body system. So that is about the mental health and mental illness. Now when you talk about mental health, there are different classifications for classifying mental diseases. We have the DSM, which is the diagnostic and statistical module for mental illnesses. Then we also have the ICD classification. The ICD classification means International Classification of Mental Disorders or Mental Diseases. So that is the full meaning of ICD, and I've also said the full meaning of DSM. So dis 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 models dey classify mental illness based on what dey present, their clinical presentation or clinical symptoms or manifestation. Dat is the way dey classify it. So after dis class, I would like you all to go on the internet and you should check more about dis classifications. So the major classification we have two major classifications. We have neurosis and we have psychosis. When you talk about neurosis is just um is a mental illness, but it is in the mild form of mental illness, while the psychosis has to do with a major breakdown of the brain. So for neurosis, we have different conditions under neurosis. For example, anxiety. Anxiety is under neurosis. Phobia. There are different types of phobia. We have fear of strangers, which is xenophobia. We have fear of water, hydrophobia. We have fear of being enclosed in a space, which is clinophobia. So there are different forms of phobia, and it's under neurosis. We also have OCD, that is obsessive compulsive disorder. Obsession, when you are obsessed with an activity, that obsession will lead you into carrying out that action, which will be in a repetitive form. So that is why they call it obsessive compulsive disorder. That is OCD. So a person might be obsessed with being neat, and for that person, when you're obsessed with being neat, the activity you will carry out, which should be in a repetitive form, will be the person would take his or her bath 3 to 4 times a day. The person can change his or her clothes 3 to 4 times a day. That is OCD. It is also under neurosis, which is a mild form of mental disorder. Then for psychosis, which is the major form of mental disorder, there we have schizophrenia. Schiz, which is SCHIZ, it means split. Then so schizophrenia simply means split of the mind. And this schizophrenia, what it does is that it affects your thinking, it affects your behavior, it affects your mood. When the thinking of an individual is affected in schizophrenia, the person might be exhibiting what I call paranoid. It means the person will be having the thoughts that he or she is in danger, or someone wants to kill him or her. So that is the thoughts of that person. Then it can also affect the behavior of that person. The person might be depressive. That one is under schizoaffective disorder. So it's a disorder that affects the mood of an individual. That's schizophrenia. Then to some people, when they have schizophrenia, they would think as if they are rich, and in reality they are actually poor. To some people, they will tell you that I am the brother to Obasanjo, I am the brother to Tinubu. That is a lie, and under that one we call it delusional grandeur. So that is another form of schizophrenia. It can exhibit in different forms. And also we have depression. Depression depression is also a major disorder and is under psychosis also. So depression is when there is a disruption in the dopamine level. The brain is responsible for secreting dopamine, and dopamine is usually secreted in response to how joyful you are. That's why you see those people that are taking hard drugs, their dopamine is usually secreted in the brain, which would maintain their thirst and their hunger for that drug which they are taking. So dopamine is the major hormone which is responsible for depression. And also we have what we call GABA, that is gamma aminobutyric acid. This is also It also plays a major function in the pathophysiology of depression. Other hormones that are responsible, we have serotonin also. It's also responsible for all dis depression, and that is why one of their drugs for managing depression or other mental disorders is serotonin SSRI, that is serotonin selective reuptake inhibitors. So they help to inhibit serotonin from entering into the brain, thereby maintaining the mood that an individual is. So legal and ethical issues on mental health is that either the person is mentally down or not, the person must be treated as an individual. There should be no discrimination, and there should be no form of maltreatment to such an individual. It is in the olden days whereby if someone is mentally down, they will take him or her to a secluded area, and they would maltreat that person. But now it becomes a legal issue if you do that. Even a mad person to say you must treat him or her as an individual. That is what you should do as an individual. They also have autonomy. They can also make their own decisions, and they also have the right to informed consent. Whatever you want to do on them, whatever drug you want to give them, you have to tell them. You have to seek their consent, which will allow them to make decisions. If you don't do that, That means you are going against this ethical um the ethics which has been laid down, and you might be liable to any form of punishment if you fail to do any of this. Then the psychopharmacological basis of this mental health, it has to do with the pharmacological aspect and also the psychotherapy aspect. For the pharmacological aspect, you have the use of drugs, medications, antipsychotic drugs, and also anxiolytic, that is um to relieve anxiety. We also have mood stabilizers like lithium, valproate, they are all mood stabilizers. Then for the anxiolytic drugs, you have Valium, which is diazepam, that is the most common one. We also have chlorpromazine. Then we also have antipsychotic. For the antipsychotic drugs, we have first generation antipsychotic, we have second generation antipsychotic. For first generation antipsychotic, they observed that they have a lot of side effects, and the side effect they do have, they call it extrapyramidal side effects. And one of the symptoms of extrapyramidal side effect is drooling. That's drooling of mucus, sorry, drooling of drooling, that's drooling of spit. That's one of the side effect, and they would also be in a confused state. So that is why the second generation, which we call the atypical medications, they are the one that are more safer to use. And an example of it is risperidone. So that is one of the antipsychotic drugs that is being used in treatment of mental disorders. So the next slide I'll be talking about is reproductive health. Reproductive health. What is reproduction? Reproduction is the ability for an individual to what? To reproduce, to bring a living organism. So that is reproduction. And in reproductive health, it has to do with the whole aspect of your reproductive system, how you care and how you manage for it. So under it, I'll be talking mostly about the ladies. Reproductive system is both in male and female, but under this I'll be talking about the reproductive system of females. So when someone is pregnant, there are things you have to do in order to ensure the safe delivery of the mother and also of the fetus. Now, one of the things you have to do is you have to what? To ensure that you go for antenatal registration. Ante means what? Before. Natal means what? Birth. That means before birth. That is the registration you have to go for. Then after you've registered, you make sure you attend your antenatal. So yeah, I'll be talking about antenatal care. What is antenatal care? Antenatal care is the care that is given to a pregnant woman before birth. That is antenatal care. And under this antenatal care, it is divided into two. We have the focused antenatal care and we have the traditional antenatal care. For the focused antenatal care, it is expected that the mother, or sorry, let me say the pregnant woman is expected to visit the hospital at least 3 to 4 times, and there is a schedule for it. The first visit should be between 12 to 16 weeks. The second visit is between 24 to 32 weeks. The third visit is from 32 to 36, and the fourth visit is 36 to 40 weeks. So during this visit, they will carry out routine screening, routine investigation. One of the routine investigation you have to do is you have to check your blood level. Is the mother, or is the pregnant woman, is she hypovolemic? That means having low blood volume. Is her PCV level, is it at the minimum range? Then you also carry out some tests like HIV test, syphilis test, and the rest of it. Then for the traditional antenatal care, that is the one we are familiar with. Whenever we go for our community posting or any other form of posting, that is the one we are familiar with, the traditional antenatal care. Under the traditional antenatal care, there you have to go for your first booking, and it is expected that as a mother you go for your first booking before 16 weeks. So when you go for your first booking, after that your next visit will be after a month, that is 4 weeks. This would be this will be the way it is till you get to 32 weeks. So from 32 weeks they will give you 2 weeks interval till 36 weeks. When you get to 36 weeks, then it will be a week interval, which means 37 weeks you have to visit the hospital, 38 weeks you have to go, 39 weeks you have to go. So that is how you do till birth, and that is the traditional form of antenatal. All of this is to ensure safe delivery and prompt detection of any abnormality during pregnancy. So they might tell you to carry out some tests. For example, they might tell you to carry out amniocentesis or chorionic villus sampling, that's CVS. So dis test may be done to detect any genetic disorder such as Down syndrome. It's not only Down syndrome that is the genetic disorder that might be present in pregnancy. You can also have sickle cell. So when you go for dis test during dis visit, it allows dem to detect it early and they will give you an option, either you want to keep the child or you want to abort. So they will make decisions based on what you have told them to do. So the next one I'll be talking about is birth defect. There are several birth defects that may occur and they are mostly congenital. What I mean by congenital is mostly from birth, and one of dis is cleft palate. Cleft palate, which is an opening in the palate of the mouth. Dis is the palate, that's the roof of the mouth, an opening in the palate of the mouth. So it might occur alone or it might be in conjunction with the lip. So the person will have cleft palate and cleft lip. Dis may disrupt the normal breastfeeding process as the child won't be able to suck effectively. So that is why we have to be aware and we have to know how to manage any of dis birth defect that we come in contact with. Also, another form of birth defect is Down syndrome. I've said that earlier in my statement. Down syndrome, that is a condition, is a genetic condition that occurs due to disjunction of chromosome 21. Yes, non-disjunction of chromosome 21. So rather than having two chromosomes, you have three chromosomes. So that is where it ends the name trisomy 21. You can call it trisomy 21 or you call it Down syndrome. So it's when there is three chromosomes instead of two chromosomes. So the person will be having 47 chromosomes altogether instead of 46 chromosomes. So the symptom, or let me say the clinical manifestation, the clinical features of this condition, the person will have a flat nasal bridge. You can see my own is pointed, but for that person, the person will have a flat nasal bridge. The person will have small ears. The person will also have webbed neck. That means it will be as if this sternocleidomastoid muscle, it will form a web. So that is another form of a feature of Down syndrome. The person might also have what I call simian quiz or palmar quiz. You should look at your palm. Your palm has three lines, but for a person with Down syndrome, the person will only have one line. That's the simian quiz. So that is one of the feature of Down syndrome. We also have different birth defect like epispadiasis, hypospadiasis. Hypospadiasis means when the urethral opening is located beneath instead of being in the middle of the glans of the penis, but it will be under. That is a birth defect. It can be corrected surgically. While epispadias is when the urethral opening is on top of the glands of the penis, that is epispadias. It can also be corrected surgically if detected early. Another birth defect you might have might be herpes palsy. No, sorry, that is birth injury. Herpes palsy usually occur when there is fracture to the clavicle or there is fracture to the upper trunk of the brachial plexus. That's when the person will develop herpes palsy. They also call it waiterman's tip because the person's hand will be stationed in a way as if the person is begging for money. So that's why they call it waiterman's tip. Another form of birth defect, we have the congenital hip dysplasia. That is when the hip joint does not form properly. So a way you can use to manage that or to correct that is when you use the Paulic harness. So it is an harness that is applied to both hip to keep it in place. Then we also have atrial septal defect. That is when there is incomplete closure of the foramen ovale of the heart. One of the major sign you will see in that child is that the person would have cyanosis. That's a bluish purple discoloration of the body. So that is another birth defect. So the next one is complication management. How do you manage complications? A lot of complications might occur during pregnancy. One of the complications that might arise during pregnancy is preeclampsia, which can also lead to eclampsia. But first, I will talk about preeclampsia. Pre means before. That is before eclampsia. What is preeclampsia? Preeclampsia is a condition in which there is an abnormal level of protein in the urine above 300 milligram per dl. That is preeclampsia. It has three features: a sustained high blood pressure. You also have the second one is protein in urine. That is albuminuria. Then the third one is the person would experience fetal oedema. Fetal oedema is swelling of the legs. That is fetal oedema. So those are the three features of preeclampsia. If detected early, it can be managed by using magnesium sulfate (MgSO4). That is the drug of choice for um managing preeclampsia. If not treated, it will lead to eclampsia. And what is eclampsia? Eclampsia is convulsion or fit during pregnancy. And just think of it, when a pregnant woman is convulsing, you see that it can lead to um dangers during pregnancy. For example, there might be abruptio placenta. That's when the placenta detaches from the wall of the uterus. So convulsion during pregnancy as a result of eclampsia can lead to dangers. So that is why it must be managed. Another form of complication that you might have during pregnancy is gestational diabetes. Diabetes occurring during pregnancy. This diabetes does not just occur because someone is pregnant. It occurs as a result of um some hormones that are being produced during pregnancy. One of the hormones is the human lactogen, the human placenta lactogen. So that is the hormone that is being produced during pregnancy, and it is anti 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 anti-diabetic and no sorry, this hormone, it works against the function of insulin. It is anti-insulin. So it disrupt the whole function of insulin in the body. It does not allow insulin to work. Also, your pregnancy hormones, your estrogen, progesterone, those hormones also, they can work against insulin, thereby leading to diabetes. And when you have diabetes in pregnancy, it is called gestational diabetes. This also must be managed. There is a regimen for it. They call it DASH. That is dietary dietary They call it the dietary management of diabetes. That means how you manage diabetes using diet only. So for that person, you go tell the person to manage how he or she eats sugary foods or sugary con ten t. It might be maybe the person is taking a lot of soda, you tell the person to reduce it. If the person is eating rice too much, you tell the person to reduce it. Beans and all those form of food that contains high con ten t of sugar, you tell the person to reduce it. Your lifestyle also is essential. You try and exercise a lot, because when you exercise you are expending the glucose you have stored in the body, and therefore there won't be any form of diabetes. So that is all about complication management. I mentioned three um complications that might occur during pregnancy. The first is eclampsia, preeclampsia and gestational diabetes. So the next one is prenatal care. That is the care during labour. So you have to know the stages of labour. There are majorly four stages of labour: the first stage, second stage, third stage and fourth stage. The first stage is divided into three. We have the latent, we have the active, we have the transitional. For the latent is between 0 to 3 centimeter, the active is between 4 to 7 centimeter, and the transitional is between 8 to 10 centimeter full dilatation. There are care which a nurse must give during these stages. For example, you have to tell the mother to maintain a proper positioning, and the proper positioning for dis stage is a left lateral positioning. The reason why you are telling the mother to maintain dat position is in order to relieve pressure from the inferior vena cava. Den also you tell the mother not to pant, but you tell the person to breathe. They should stop panting, because if they pant they are expending their energy, and that energy shouldn't be expended at that time. It should be during the second stage of labour, which is the delivery part of the labour. So you tell the mother to what? To breathe instead of panting. Then also you would ensure that the mother you ensure that the mother is in a comfortable position, and you tell the mother to rest. This is because you have to conserve energy. So you tell the mother to rest. She shouldn't be roaming about, she should rest. When the mother is in a resting state, then the energy is also what? Is also expended minimally. The second stage is the delivery stage. That is when full dilatation has been when there is full dilatation and there is full effacement. So the baby is able to maneuver his way to the vulva, which is the external genitalia, and then delivery takes place. The third stage is the delivery of the placenta and its membrane. So that is the third stage of labour, whereby you deliver the placenta. You either use controlled contraction, that's CCT, or you use manual evacuation of the placenta. Then the fourth stage is the recovery stage, and in this stage all what you are concerned about is what? Assessing the lochia. That is, lochia um is a form of blood stained mucus that comes out of the female reproductive system. Let me say the female vulva after birth. So as at that time there are stages of lochia. We have the lochia vulva, the lochia serosa and the lochia alba. So you have to know the difference between dis lochia. Then also another thing you have to manage during the fourth stage is involution. Involution is the process whereby the uterus returns back to its pre-gravity stage. So at first the uterus would be rigid, because as contraction is taking place it will be firm and rigid. So that is when the uterus is contracting as a result of oxytocin which has been injected, and once delivery has occurred, the brain also, there is a positive mechanism that is being initiated in order to allow more hormone to be released into the body system, which will aid contraction. So the uterus contracts gradually till it returns back to its pre-gravid stage. Then the postnatal care. For the postnatal, sorry, um I talked about the postnatal care when I talked about the low-care and involution, that is postnatal care. So neonatal care, how you care for the fetus. You have to carry out your APGAR score, appearance, pulse, grimace, activity and respiration. You have to carry it out to ensure that the baby is well accustomed to the external environment. You know the baby is coming from the internal environment, which is the uterus. So now the baby is in the outside, that's the external environment. So you have to check how well the baby has adjusted to the external environment. So you carry out your APGAR score. When you carry it out, then you are able to diagnose if the baby is well or the baby is not adequately well. If the baby is not adequately well, you can take the baby to NICU for proper management. Hormonal functions. What hormonal functions is all about is hormones that play a role in pregnancy. You have your progesterone, you have your estrogen, you have your prolactin, which is responsible for breast milk production. And you should also know that um colostrum, which is the yellowish portion of breast milk, is usually produced during the 16th week of gestation, and this is the production is till birth, and that is why you would allow mothers to initiate breastfeeding immediately after delivery. So the reason is that it allows the baby to suck in that colostrum, which is the yellowish substance, because it contains a lot of nutrients, and apart from the nutrient aspect, it also contains antibodies. These antibodies help to fight against infection. The fetus no, the baby's liver, the neonate liver is not yet developed to fight against infection. The immune system also is not yet fully developed to fight against infection. So its immunity is dependent on the mother, which is why you have to give the baby colostrum immediately after birth. Then family planning, there are different types of family planning. We have the natural type of family planning, we have the surgical type of family planning. For the natural part of family planning, we have what we call sympototama. Dat is the accessing of the cervical mucus, dat sticky substance that is in the vulva of a female. When it is stretchy, and thin, it means the woman is towards her ovulation. So once what dat woman would do is dat the woman would abstain from sex. That is sympototama. Sympototama. The tama is when you measure, you will try to assess the basal body temperature. So it is expected that during ovulation there will be a slight increase in the body temperature. So that is sympototama. Then we also have the surgical aspect. The surgical aspect is tubal ligation and the vasectomy. Tubal ligation for female, vasectomy for male. For tubal ligation, they would cut and they would tie. That is the meaning of ligation. That is the layman interpretation of that. So they will cut the tube, which is the fallopian tube, and they would tie it together. That is the ligating. They will tie it together. So it will prevent the contact of sperm and the ova, which is being released. Then for the vasectomy, that's just the removal of the vas deferens. The vas deferens is the place where sperm is being stored. So it's not that the person would ejaculate, but it will just be fluid, that is just having semen. There won't be sperm, viable sperm in it. So the person won't be able to reproduce, and they usually do this for someone who has given birth to his desired amount of children. For example, I want to give birth to 5 children. After I've given birth to 5 children, I can go for vasectomy as a male. So that is family planning, the surgical aspect of family planning. We have the hormonal type of family planning where you give levonorgestrel. That's you have the combined oral pill, and we also have the progesterone only pill. For the combined oral pill, we use it for 28 days. It has 21 days for the drug containing levonorgestrel and progestin. Then the 7 days is the one containing the folic acid. It is red in colour, so it is usually beneath it after the one you use for the first 21 days. So the reason why they usually give that one is to enable more production of blood, because they believe you have lost enough blood. So then for the progestin only pill, that one only contains progesterone. It only contains progesterone, so they also give it out. It's just for 21 days. Then we also have injectables. For injectables, we have Depo-Provera, we have Noristerat. Depo-Provera is for 3 months, Noristerat is for 2 months. Then we have implant. Implant also is hormonal. For implant, you have Jadel and we have Implanon. Jadel has 2 words, Implanon has 1 word. For Jadel is 5 years, Implanon is 3 years. Then we have the barrier method. For the barrier method, we are very common. We know about that one, and that is that is the condom for male. There's also female condom. It has an open pouch whereby you would that one will be in the external part, while the closed ring would be inside the vagina. You will insert it into the vagina. So this barrier method is not really effective. That is why you have to combine it. They do combine it with either hormonal, which is the pill, or you combine it with spermicide. That is when you use queen that is injurious to the sperm. So they destroy the sperm cells. So you usually combine them together, the barrier and the spermicide, or barrier and hormonal pills. Then another form of family planning that we should know about is the IUD, the intrauterine device, and that one lasts for 10 years. So there are majorly two forms of IUD. We have the copper T, the other one is hormonal. The other one is hormonal. I think that's Mirena. That's the name, if I'm not mistaken. That's Mirena. So for the IUD, which is the copper T, it is usually inserted into the uterus in order to prevent contact of sperm and ova. Then the copper also is toxic, so it also damages the sperm cell, which means it is having two functions for copper T. But for the hormonal, it only regulates hormones that are responsible for production of egg and fertilization. So it will inhibit those hormones. The pros and cons, what you should know is that there are some pills that should not be used during breastfeeding, because it can interfere with breastfeeding. Some of them might reflect in the breast milk which you are giving to the baby, which may be injurious to the baby's health. So there are things you should know before opting for any form of family planning. Also, your weight is usually assessed. For example, you don't give implant to someone that is obese. The reason is that one of the side effect of implant is it causes weight gain. It's just as if um you are aggravating the pre-existing condition of that woman. So that is why you don't give implant for an obese patient. And also there is possibility that it might get lost in the fat. They usually have excess fat in the body. So that's why you don't give implant for anybody that is obese. So that is all under reproductive health. The next one I'll be talking about is your nursing research. So What is research? Research is a systematic investigation that aims to identify a problem and offer solution to that problem. You have identified a problem. How do you want to solve this problem? So you have to carry out a research. That is the major aim of a research. So in your research, you have your variables. For your variables, you have the independent variable and you have the dependent variable. The independent variable is a variable that is not affected during your course of study or your course of research, while the dependent variable is usually affected. For example, if I'm to tell you, if I give you this topic, effect of high blood pressure on pregnancy, the independent variable is high blood pressure because it remains constant, while the dependent variable is your pregnancy, because high blood pressure would what? It would affect pregnancy. So that is how you can differentiate between independent variable and dependent variable. Your nursing proposal, it has to do with chapter 1 to chapter 3. For your chapter 1, you have your literature review. Those are the past research that has been done concerning the research you want to carry out now. Because there is no research you want to carry out that is new. You are just building on pre-existing researches. So that is what your chapter 1 is all about, the literature review. So you have to cite authors, researchers, their work. You have to cite it in your chapter 1, which is your literature review. You also have your research problem. What do you what is the problem that you've seen and how do you aim to solve the problem? You have your significance of study. You also have the limitation and scope of study. So that is all about chapter 1. For chapter 2 and for chapter 3, so that's the body of the research. What you have carried out, what is your observations. So you write it out also, and you make sure that you cite references. Either you obtained it from the internet, there must surely be an author that has researched on it before, so you must include that. You either use insight references or you would create a reference list which will be added after your research. Then your quantitative and qualitative methods. In research, we have different type of research. Let me say that first. We have different type of research. We have the quantitative research and we have the qualitative research. For quantitative research, it has to do with numerical values, data that you can experiment, you can carry out, and your data or your information, sources of information is usually gotten from experiment. We also have medical records. While for qualitative research, it has to do with is explorative in nature. What you just want to get is what people are experiencing, their experiences. You want to get their experiences about a major problem. Like when you talk about the issue of rape, so you carry out interview, you carry out observation, focus group. Those are your sources of data for qualitative research. So you carry out focus group, your interview, just to get people experiences from whatever you are carrying out, you are carrying out your research on. Then the importance of research dissemination, you have to tell them the reason why you are carrying out the research. That is informed consent. In your research, there's a place for ethical considerations, yes. So under it, you have informed consent. Whoever will participate in your research must make informed consent, informed decision. You do not coerce them, you do not force them. It must be willingly. They must be willing to participate. It must not be under any form of force or threat. That is the ethical consideration. Then confidentiality. You must ensure that whatever information they've given to you, it's just between you and the participant. And that is why in any form of research, you don't give out names. If you are to use a questionnaire, you don't tell them to write their full name. You can make use of initials, OA, IB. So all of that is just to ensure confidentiality. The information they have given out must not leak to the public. It must be between you and the participant. So that is all under your nursing research. So the next one is emergency and disaster nursing. What you should know under this is triage. What is triage? Triage means sorting out, prioritizing care. When you are faced with emergency, how do you manage your emergency? How do you manage your emergency? You try to sort out your patient. You either use the color code for triage or you use ABCD of triage. For the color code, you have red, you have yellow, you have green, and you have black. For red, it means urgent intervention, life-threatening condition. So whatever intervention you have to do, it must be immediate. That is immediately. You must carry out your investigation or your intervention immediately. So that is for red. While for yellow, yellow means urgent. There is difference between urgency and emergency, which is immediate. Urgency can be between the 24 hours interval, but emergency or immediate, it must be carried out immediately. For example, if someone has ruptured appendix, it requires immediate intervention, otherwise the person might lose his or her life due to peritonitis or infection. So for urgency, it has to be between 24 hours interval. It is not a life threatening condition, but it requires intervention. So that you will classify that under yellow. While for green, green is minimal. It means the person has a minimal injury. Maybe the person has bruises, just bruises, laceration, cut, all those ones they are minimal injuries. While black means brought in dead or expected to die. That is black. So what you just have to do is minimal care is given to such a patient, because at the end the person would surely die. So that is why you classify that under black. Then the ABCD, you have your airway, breathing, circulation, and the D is your disability. For airway, you have to ensure proper airway. How do you ensure airway? Through positioning. The way you position your patient, if that person is having difficulty with breathing, you might place that person in a fowler position or semi-recumbent position. So the reason why you are doing that is to ensure adequate airway. That means the person's airway is open. Another one is the breathing. You ensure that the person's respiration is constant. The person respiration, there are qualities you have to check out for. You check out for the rate of respiration. Is it rapid? Is it slow? You check out for the depth. For example, if I do like this, I just breathe, I breathe, but the depth of that breath is is deep, is deep. So that you have to classify the respiration as, is it deep or is it shallow? That is the depth. Then you also classify based on volume. So for the respiration or for the breathing, you have to assess the respiratory rate of that person, if it is fast or if it's slow. If it's fast, you have to ensure that you are able to bring it to the normal level, which is the normal respiration. Then for the C, that's the circulation. The circulation, how blood moves from one body part to the other. If there is bleeding, the circulation would be affected. Or if there is shock, the circulation would be affected. So for someone having shock, probably hypovolemic shock, the body system would direct blood flow to the major organs of the body, such as the heart, the brain, the kidneys. So there will be pulling of blood to the upper part, while the lower part will be lacking blood. So if you touch such person, the person's extremities might be cold because blood flow is not going to the lower part of the body adequately. So that is all about triage. Triage just means sorting out patients based on order of priority, how they need care. That is triage. And the other one, prioritization of care. I've said it earlier, how you prioritize care, who you should answer first. Is this someone with a respiratory problem or someone with breathing problem? You should know that you have to prioritize breathing or respiratory problem before bleeding. So management of emergencies, cardiac arrest, stroke, trauma. How do you manage cardiac arrest? You either give CPR, that's cardiopulmonary resuscitation. There is a way you carry that out in order to prevent injury or trauma to the sternum or to the ribs. Don't apply excess pressure, otherwise you might damage the ribs. Or you also do defibrillation, but now there is an automatic defibrillator. They call it AED, automatic external defibrillator. So you just apply the patch on the body and it sends electrical impulses to the heart in order to bring about its conductivity back. So stroke, how do you manage stroke? There is an acronym for stroke, that is fast. The F is face. So you would assess the face to note if there is any facial drooling. That's a portion of the face would lose its elasticity. So you observe if there is facial drooling. Then the A has to do with the arm. You would assess the arm also, which is the hand. You assess it if one part is lower than the other. While the S that you are talking about is speech. You might tell the person to pronounce T. The person won't be able to pronounce T. So that is the speech. The speech will be affected if stroke occurs. Then time, T is time. Time has to do with how quick or how fast you are able to call for emergency, because time is also crucial in management of stroke. If there is a quick intervention, then it is possible that the person will be able to bounce back to normal. But if the intervention is slow, the person might take longer than expected. Then how do you manage trauma? The first thing in management of trauma is your assessment. You have to assess the patient that is being brought to you. What form of trauma? Is it due to accident? Is it due to violence? Is it due to gunshot? So depending on the trauma, the type of trauma would determine the management you are to give. If it's gunshot injury, you know that you are to apply pressure to the affected part in order to keep in order to you have to apply pressure in order to prevent bleeding, because if you don't apply pressure, the person might bleed to death. So you also ensure that you remove the bullet, because if you don't remove the bullet, it will damage internal organs. And once the internal organs are affected, it is injurious to the person's health and it may lead to a long-term condition. So management of trauma, it depends on the trauma that is being brought to the hospital. Den disaster preparedness and response, dat means how you prepare for disaster. In an hospital you should be prepared for any form of emergency, and dat is why you must have adequate staffing and adequate equipment in your hospital or in your facility. So disaster preparedness means how you prepare for upcoming disasters or emergency. There might be earthquake, there might be natural disasters. So you as a facility, you as someone that is organizing or that has an institution in the form of hospital or any healthcare, you have to prepare ahead before danger. So that is all about emergency and disaster nursing. The next one is your medical surgical nursing. Here I will be talking about systemic disorders. For the systemic disorders, we have different systemic disorders like heart attack, heart failure, and the rest of it. So how you care for it? Cancer is also a systemic disorder. Stroke is also a systemic disorder. So this aspect of nursing, the medical surgical nursing, is just trying to tell you how you manage these conditions. But before management, you have to know the pathophysiology of each condition. You have to know the pathophysiology of hypertension. You have to know the pathophysiology of stroke. How this condition, how it manifest, you have to know them. The clinical manifestations, you have to know them before you will be able to care for it. Chronic illness management, there are some conditions that they are chronic in nature, though it might start from acute stage before it will progress. For example, breast cancer. Breast cancer can start from the acute stage before it will become chronic in nature, whereby it can affect some other organs. It can affect the lungs, it can affect some other organs in the body. Den when you talk about palliative care is the care that is given to an individual either in the home or in the hospice hospital at their own comfort. The reason you are giving palliative care is to manage the symptoms exhibited by the condition. You are not managing to heal, you are managing to care, to ensure comfort till the time of death. Dat is palliative care. And you usually give dis type of care to patient with terminal illness such as cancer. Probably the person is in the end stage of cancer, end stage kidney disease, end stage breast cancer. So you give palliative care to such patient. So that is what you are to expect in your medical surgical nursing. You have to know different conditions that affect the system, the conditions that affect the heart, the conditions that affect the respiratory system, the conditions that affect the gastrointestinal system, the conditions that the illnesses or disorders that affect the reproductive system and the rest of it. For your health economics is just how you manage resources in the health facility or health institution. You also know that human beings are also resources. Your equipment, they are also resources. So how you manage these resources for effective care, that is all about health economics. Then there is the concept of demand and supply. For the concept of demand, that is the quantity that a consumer is able to demand at a given period of time, and this is usually affected by a lot of factors. For example, income. If you are not earning enough, you won't be able to demand for adequate health care. If you don't have access to access to an health organization, you might not be able to receive adequate care. So that is for the concept of demand. While the concept of supply is the quantity of health service or health product that a provider, a service provider is willing to offer at a given period of time. So that is all about the concept of demand and supply. Your income will play a role, your age, that those are your demographic status, your age, your sex, it will play a role in this, because we know that ladies dey do visit health institutions than males, because we believe that we are okay, we are alright, we don't need any form of intervention. But ladies, any little inconvenience dey will visit the hospital. So these are the factors that affect demand and supply in the healthcare. We must also know how to allocate resources. The resources I'm talking about is how to allocate staffs for each unit, how to allocate equipment for each unit. The equipment that will be in ICU won't be the same in maternity ward. The equipment in ICU won't be the same in medical ward. So those are resources allocation and how you allocate funds for the institution. Then when you talk about budget, every organization dey do budgeting. Even you as a student, you budget based on your allowance that you receive. How much I'm going to spend in this month, how much am I receiving? That is your budget. So budgeting is what keeps an organization afloat. There are different types of budgeting. We have the capital budgeting and we have the operational budgeting in healthcare. For the capital budgeting, what that budgeting has to do is, it has to do with activities that promote income, that promote revenue. For example, you want to expand your facility, you spend money on it. That is capital budgeting. The money you have prepared to spend on that project in expanding your facility. Because when you know that when you expand your facility, you have more clients, more patients coming in. And once there are more patients, you also have more income being generated. So that is capital budgeting. But operational budgeting is the money prepared, money assigned for staffing and operational activities. How you run the hospital, day-to-day activities of the hospital, that is your operational budgeting. For cost effective analysis, that is the way you minimize waste in the hospital by adequate staffing. You ensure that there are no excess staffing, because if there is excess staffing, you also spend more on their salary and the hospital may run at a loss. So that is cost effectiveness analysis, how you tend to minimize wastage in the healthcare. So that is all about health economics. Then for politics and governance in nursing, this is just trying to enligh ten us on what we should know as a nurse. There is a body that is regulating the nursing activities, both accreditation, licensing, and also in making institutions available to train nurses. So this aspect is just trying to enligh ten us about the functions of this body. For example, your NFCN, what they carry out licensing, they carry out registration, they carry out accreditation. Without NMCN, no institution will be accredited. So you have to know about this also. Then also you should know about professional organizations. For example, when you have successfully completed your study, you have to be joined to a professional body. I think when I'm here with my certificate, I would have showed you. The certificate is given by NMCN. That is a professional body. We also have NGOSA, University Graduate of University Graduate of Nursing Student Association. That is NGOSA. So during our induction, they were also present. Those are professional organizations that have been established to ensure proper running of the nursing program. So you should also know about them, their function, their role. You should know about it also. Then nursing informatics. This will just tell us about how information is being transferred, is being sent in healthcare. So before, formally, we do pen down our information. After word, after each word round, you will see nurses writing down what has been said. But now we don't do that again. We do what we call electronic health record. So we do it electronically now. So we make use of computers in keeping of information. Even your patient information, we make use of computers to keep those information. You want to write your nursing report, instead of writing it in paper as before, now it is electronically. You make use of the computer to write your nursing report. So all of this is just to ensure proper running of healthcare. And also the reason why they are doing this is to minimize cost. Because if you want to buy card, if you go to hospital, you have to buy card, you have to buy this, you have to buy that. So instead of doing all those things, you just go to the counter, you tell them your name, they will collect your record, your history taking, they will collect everything, and it will be recorded in the computer. No need for card again and all those file. You don't need them again. Then when you talk about telehealth and remote monitoring, this is just telling us how we can offer nursing services using telecommunications. You can either use your phone, through WhatsApping, through video call. You can also teach. This one I'm doing also is telehealth. I'm giving information via the internet. So this is also a form of telehealth. Then remote monitoring. Then technology has advanced to a stage that I can be here and I'll be carrying out operation elsewhere. All I just need to do is to dey call it robotic assistant surgery. So it's also a form of technological tools that is being used in nursing to ensure proper running of our nursing program. So that is all you have to know about nursing informatics. Then the last one, which is management in nursing. This will tell us about different types of leaders, their leadership style. Are they autocratic? Are they democratic? For autocratic, whatever they say is the final say. You have no input to add. But for democratic, they collect input from each members. So those are the different leadership styles we have. We also have the laissez-faire form of leadership. We also have the transformational leadership, which is the best. Then we also have the transactional leadership. That one is just based on transaction, what you tend to gain from your followers instead of giving, but you are receiving. So that is the transactional form of leadership. When you talk about teamwork and collaboration, how you collaborate with different teams in the healthcare, how you collaborate with nurses, with doctors, with social workers, physicians and psychologists, how you collaborate in order to ensure adequate care is given to your patient. Teamwork. No business will strive without teamwork. So there should be cordial relationship between the teams that are represented in the organization. Then how you tend to manage conflict through conflict resolution. You can either use dialogue. You call the two parties, if there are more than two parties, you call them together and you try to resolve the issue. So quality assurance and risk management. Quality assurance is telling us how we ensure that quality care is given to our patients, is given to our clients whoever comes to seek medical intervention or surgical intervention, they receive adequate care. So there should be quality assurance. No institution, every institution would carry out quality assurance because they have to ensure that they are giving out the best to their clients and to their patients. So this is the end of the lecturing. I believe we've learnt a lot in this. And if there is any other question that you would like to ask, I would love to know. So thank you very much. Thank you for attending today's lecture. Hope to see you guys soon. Bye. Take care of yourself.
All right, I'm sorry that I'm just coming back on. My network is really bad, so I just came back and I've seen that our speaker is already done. So I hope you've been able to learn a thing or two from him concerning paper two, and now you're no longer scared of paper two. So I've been behind the stage listening to what he's saying, and I've seen that it was very detailed with explanation and what is what it is that you need to actually know in the areas in each of these areas for paper two. So with that being said, I wish you good luck and I hope this helps you in your endeavor. Now, wrapping it up, I'm going to say thank you to everyone that watched this live, and I'm going to say thank you to anyone that is going to come back to watch after the end of the live. And please, after watching and you find this very, very useful, don't forget to like the video and please subscribe. Thank you.